Prime Minister Narendra Modi announced the launching of National Digital Health Mission in his Independence Day speech from Lal Killa. It is meant to act as a single convergence point for patient, doctors, hospitals, different departments, pharmacy. Later on, it would also include the facility of telemedicine or e-pharmacy. It simply means that patients will no longer need to carry different hard copy of different departments or doctors or prescriptions or the test. Putting in Prime Minister's word, it will be like a digitized Swasth Khata or health book for a patient and will contain details of their medical history, physicians consulted, test done, etc. Its blueprint was prepared last year in 2019, which says that its overall vision is dependent on the National Health Policy of 2017 in perspective and recommends a pragmatic agenda to start with. It also adopts the principle of think big, start small, scale fast. It forms the foundation on which the edifice of an entire national digital ecosystem can be built in a phased manner. Furthermore, it finds its root in National Health Stack that was proposed by Niti Aayog. Key factors in this blueprint were identified as persons, care professionals, case providers, payer, governing bodies, research bodies, and pharmaceuticals. 5 plus 2 layer of architecture was introduced in this, in which infrastructure, data hubs, technology building blocks, application building blocks, and access and delivery were different layers. In one of the chapters on standards and regulation, the blueprint discussed on consent, context and interoperability, privacy and security, and the patient safety and quality of services. Among various IT services made available by the government, it recognized the importance of UIDAI, GSTN, and NPCI as the role model for implementation of a health mission. Based on different analyses and the case studies of UK and Korea, South Korea, its recommendation was that a new organization with a governing council and board of directors should be constituted, that is the National Health Mission, and then after ownership should be fully with the government so that the data protection can be optimized. It will provide the services on health ID, PHR at registries, open API for insurance and health fiduciary. That is the AA model. Its vision and mission was to be the best healthcare network in the world and to provide every Indian with access to digital health services. And so its expected outcomes were that uh, the citizens should be able to access their electronic health records in a convenient manner, preferably within 5 clicks. Citizens need to undergo any diagnostic test only once during the course of an episode, despite taking treatment from different health services providers. Citizens should get integrated health services at a single point, though multiple agencies, departments, or services providers are involved. NDHM shall also assure continuum of care to the citizens across primary, secondary, and tertiary care and across public and private service providers. A framework for a unified communication center will also be prepared to facilitate voice-based services and outreach. NDHM shall also support the national portability for healthcare services, privacy of personal and health data, and consent-based access of EHRs will be the invaluable norm that shall be compiled by all systems and stakeholders. And DHM will be aligned to the SDGs related to health. It will enable evidence based interventions in the area of public health. Above all, the analytical capability of NDHM will support data driven decision making and policy analysis. Since health is a state subject, it is essential that both the central and state government would be the joint owners or stakeholders in this organization. Moreover, the structure of the organization should include two separate arms, one for regulation and other for operational management.